Hello, future doctors and fellow horse enthusiasts. My name is Dr. Hannah May, and you are listening to One Stride at a Time, a podcast brought to you by the Equine, getting you started in the equine industry one stride at a time. Before starting out, I'd like to thank our sponsors, Glenwood and Silt Veterinary Clinics, for getting us up and running with this podcast. Glenwood and Silt Veterinary Clinics are the oldest and only locally owned mixed animal practitioners of the Roaring Fork Valley. Glenwood Veterinary Clinic has been providing the same trustworthy care since 1936 and is proud to open the new Silt Veterinary Clinic in November of 2024. Before starting this episode, I will warn you that this was recorded at AAEP conference, and so some of the background noise might be a little bit of a nuisance, but please bear with us in this first podcast mini-series, and the future podcasts will not have the same issue. Thank you, and we hope you enjoy.
Hello, future doctors and fellow horse enthusiasts. My name is Dr. Hannah May, and today I am here with...
Hi, everybody. I'm Dr. Brittany Veerasammy. I am a third-year surgery resident.
You are so close to finishing your residency.
I am.
How does that feel?
It's surreal. I can't believe that it's got to this point. I've dreamed about doing this. I've dreamed about doing this since I was 12.
Yeah.
And now I've gotten to the point where I've succeeded my wildest expectations. And
I'm
it's
so
unreal.
proud of you. I'm so excited to know you. I mean, I just, it's so amazing how to see your journey, and I get to see she's on social media. What is your handle again?
I think it's just at Dr. B. Veerasammy.
There you go.
Yeah.
So make sure to follow her. But it's just been amazing to watch your posts of you as a little girl riding horses, and I can tell that it's been your dream for so long. Do you have reflections that you want to talk about? Especially there's so many people who want to be in your shoes someday.
Yeah.
What kind of words of wisdom do you have for them?
I think a couple things. Your career is your own. It's what you make of it. I actually just caught up with my mentor, and I wanted to be her so badly. And that's what she told me. She said, Brittany, your career is your own. Mm-hmm. And at first I was upset. I was like, what do you mean? I want to be you. Why can't I be you? But I understand now, because it's whatever you want to make it, and there's no ceiling. Yeah. And I think that if you want to be an equine vet, you want to do large animal medicine, you can do it. There's nothing and nobody should stop you. And I think that's more a reflection of themselves, and just keep at it, keep networking. And it's hard because you may not get the right fit the first time. You may not always get it right. You may have to fall down and you get back up, but just keep going and you will find your family. And I just reconnected with mine at AAEP, and I was introducing them to my intern, and I said, this is my family. These are the people who made me the doctor I am today. And I'm so thankful to have known them and to have the ability to call them so much more than colleagues.
That's amazing.
Yeah.
What are steps that people can take? And remind me, to be a veterinary surgeon, you have to do your undergraduate degree. You have to go to vet school.
Yeah.
You have to do one or more internships.
Yep.
And then a residency.
Yeah.
So what are some things that you need to work on, or if people want to be like you someday, what do they need to prepare themselves for at each step?
I think setting yourself up with a really good internship program where you have good mentors that will teach you, because you're not going to know everything coming out of vet school. And you know what that's like. It's a very steep learning curve. You're not always going to have the answers, but you need to be able to have the resources to get what you need to succeed. And I think that's the biggest thing. So go somewhere where they take a lot of interns, they get them matched to programs. I did a lot of research as well. So I did 2 internships, then I took some time off and did a master's, whether that's actually time off or not, and then I did another internship, and then I matched with my residency program. So in addition to being really good on the clinic floor, also having a keen interest in research. And it doesn't have to be a very serious bench top. Maybe do a case report, maybe do a retrospective, but make yourself a well-rounded applicant and just work hard and have a good attitude. That's the most important.
Yes, I agree entirely. And so with such a long journey, and you're finally at the cusp of it, what are your goals going forward now?
So many people ask me that. They're like, where do you see yourself in 5 years? I said, I don't know. And I think that's a really good thing to recognize, because we all have these goals and dreams and ambitions. And I meet some vet students or interns that are like, I don't know what I'm going to do. And I said, I don't know what I'm going to do in 5 years. But I think, I would like to be on more diversity committees and continue to champion that because that's so important to me. First and foremost, passing phase 2 of my boards, getting a big girl job, becoming a proficient surgeon is important, and working in a team where we all get along and we have fun and I can build a caseload and clients. I think that's what I'm looking forward to after residency.
That's so exciting. I'm so excited for you and the opportunities that you'll have going forward.
Yeah.
And also, I think it's something that I've felt too, like graduating vet school, and I didn't do an internship. So now I'm like, okay, well, now what? And I think you learn to feel safe and excited for the opportunities because you don't have to know what you're going to do next. Like, you can take opportunities as they come and follow your passions, because sometimes that'll lead you to something that you never even thought was a possibility.
Yeah, and I think that's the thing. You don't realize how many opportunities are out there until you put yourself out there, and that's so scary. When you're a vet student and you're just trying to pass the next midterm, you're not thinking about, a couple years down the road, but take the opportunities as they come. Like, come to AAEP, come talk to us, come see us, come to ACVS, come to AVMA and network and put yourself out there, because you're going to benefit 10 times, 100 times over.
Exactly.
Yeah.
And then earlier you touched on something that I definitely wanted to bring up with you, knowing both of our accounts and our values. Diversity. Can you speak to me? I'm so excited to have you as a person of color to be a representative in this community, because I talk about it on my platform all the time. There is a need for that. It is such a shortage. Most equine vets and veterinarians are all Caucasian. Can you speak a little bit about the diversity and what we need? It's such a big topic. I don't want to take too big of a chunk at once.
No, and I think, when we broach it and we come from the side of the majority, it's overwhelming for a lot of people, and people don't understand. They ask, is there racism in veterinary medicine? And to that, I would say there are biases that we all need to address. Then they say, well, I don't see color. Please don't say that. That's very derogatory and not appropriate. I think what's the most important is to value people for their work ethic and who they are, rather than anything else that defines them visually or how they identify. And I think we've lost sight of that. There's also an issue in our industry in the sense that the people of color we tend to see are those that are handling the horses or cleaning the stalls or in a role that's not doctor. And I often question this in the sense that, what sort of subliminal messages are we sending to prospective large animal veterinarians when they don't see themselves in roles that they want to be in? So that's why it's important, is because I could see myself in a role, because my mentor is also a woman of color, and because she did it, she walked so I could run, and I'm going to run so everyone else has the exact same opportunity. And we need to stop fitting people in a fixed narrative of what we think an equine veterinarian is. Sure, if you want to wear a cute little hat and your vest, I think you look fabulous. But I also like wearing a skirt and sandals, and that doesn't mean I'm any less of a doctor than you are, just because I don't wear the same clothes as you. And I don't think we should subscribe to that narrative.
That's even like for me, not growing up necessarily in the same horse industry as others in our industry. Like, I feel like there's been such a pressure to look a certain way and act a certain way. And especially the male versus female thing is still there. Like, unfortunately, it's still there. It's still going to be there unless we're working to change what it looks like you said, to be an equine veterinarian. And I wear this because this is what I like wearing. You wear that because that's what you like wearing. And it doesn't affect how we act as veterinarians at all. There's no difference in what clothes you wear.
Exactly. Like, at the end of the day, am I going to show up to your colic in this? No. Exactly. That's such a ridiculous notion that I would dress like this. I'm not going to wear a ball gown to do the exploratory coelotomy. So please believe, when the time comes down to it and the gloves are on, I will be there and I will be appropriately dressed. But in the meantime, I am going to express myself the way that I want to, and there should be no that should not be met with scorn or derision. And I think that we need to practice that just a little bit more. And it comes down from the top. It's at the top. If you don't make the changes there, then us at the bottom, like coming out of our careers nice and new, like there will be no change.
Yep. Yeah. And so then speaking to, I always talk about less and less students pursuing equine medicine in general. Like, what are your thoughts on reasons why students aren't going into the equine industry, and what can we do as an industry to promote it?
Yeah, it's tough because people come out with a lot of debt. We're not making money like small animal surgeons. And so it becomes a passion that you stick out, and hopefully you can endure the loans and make it work and pay that back. But I understand why the appeal is not there like it used to be, and the out of hours is not always appealing if you want to have a family. I don't have the solution to anything, which I wish there was an easy fix. But I think that we need more accessibility to our industry as well, because we're missing out on a bunch of people that could be, wonderful. We just don't know it.
Yep.
And by that, I mean, whether we should be talking at a more grassroots level, going to high schools and middle schools in places that don't have horses, because we all know about 4-H growing up. We know about the opportunities if you live in a rural community, but if you're an inner city kid and you want to be a racetrack vet and people say that's preposterous, who are you to say that? I think that you need the resources available to you, and I think we need to make ourselves more accessible, and maybe we can get some new ideas, fresh mindset, and then we can go from there.
I agree entirely. And there's also there's so many students that I meet that they came to vet school for small animal reasons, but they do love horses and have an interest, and then no one ever catered to that interest, so they just gave up on the dream. And so I hear that too often, and so I agree, making horses more accessible to not only vet students, but also even before that down to the high school or elementary level. Just the early on exposure can really initiate that love that is required for this career.
I agree. And I also think that, when you first, and a lot of us, when we first started getting into horses, it's not like we were born and we knew how to tack a horse up. We knew how to groom them. We know somebody took the time and taught us. We just have been doing it for so much longer that it's second nature to us.
Yes.
And I think that we need to fix that narrative. If a student asks what's cribbing, we don't go, oh, you don't know what that is.
Exactly.
We say, well, cribbing is, a stereotypy, and we explain it to them. Or if they ask, what is roping? What does that look like? I bring up videos with the students when we're not busy, and we just YouTube all the different disciplines so that they can see it. I mean, I didn't grow up in Western performance. I didn't know anything about cutting horses until I moved to Australia. I didn't know about camp drafting, and I learned, and I asked owners questions, and the owners are really nice, and they'll explain how things work and how their competition works, and they're passionate about it, and they love teaching. So
yes.
I think we also need to not be afraid of asking questions. If you don't know how to put on a halter, just ask. We shouldn't make fun of students because they don't know. We also didn't know when we were 5 or 6 either.
Exactly. I do get messages all the time of students who are frustrated, whether it be on an externship or on a rotation, where they had to ask a question like that was embarrassing. I mean, it's hard to even ask questions like that.
Mm-hmm.
They feel embarrassed. They don't want to ask questions because they feel like they're going to be judged, and then when they get greeted with treatment that is like, why don't you know this, it's just not getting us anywhere. And so I agree, we need to welcome these people with open arms and make sure that they're heard and they feel the nourishment that they need to grow to, because maybe someday they will be in this profession. You never know who's going to be inspired by you. So
some of the best specialists I know are not horse people. They didn't grow up with horses, they didn't ride horses, but they are phenomenal horse doctors.
Yes, exactly. And same here. I wanted to go back to, what are some resources for people that you know of for anything regarding equine, diversity, vet med, everything that you want to give a shout out to?
Ooh, okay. Diversify Med It's great for opportunities. I worked with them during ACVS. They had a scholarship grant that I applied for and was the recipient of.
Yes.
So that's on my page. I also have several diversity, equity, inclusion links under resources on one of my highlighted stories. Voice is great. I think it's DEIB as well. They post a lot of initiatives and how to navigate different cultural experiences. And that's the thing, just because I'm brown doesn't mean I don't have biases and prejudice. I'm learning every day as well. I'm not absolved from making a mistake either, but I want to get better. And I think there's a lot of great books out there. I read a book recently called Why Are All the Black Kids Sitting Together in the Cafeteria? I love that book. It's really good. It's very insightful. There is an author called Priscilla, I think Dolores, I think is her last name. She is a lecturer at Vanderbilt. And she wrote a book called To All My Brown Girls with Sharp Edges and Tender Hearts. That was a very eye-opening book as well. I love that one. But there are a lot of great resources out there. And I think that by following you, you post a lot of things. That's very helpful.
I try my best. Sometimes I slack a little bit, but
I've been slacking too.
It's busy.
It does get busy.
But that's one of my goals in the new year is to be better about posting on my main page as well as my company page to keep promoting this industry.
Yeah, and AAEP does a fantastic job. I used to sit on their diversity committee, and they have great initiatives, and they're open to ideas because we don't have all of the answers. And I think, putting yourself out there and emailing them as well would be great. ACVS, they have a diversity committee, and they are fantastic. And to my knowledge, we're one of the few colleges that are paving the way forward with our committee.
That's awesome.
Yeah.
That's awesome to hear.
Yeah.
Amazing. Is there anything else that you want to talk about while we're here for the viewers of this video that you want people to hear?
You can do it. You just need to find your tribe. And it's not going to be an easy road. It's going to be hard at times. But I think it's worth it. I think it's really, really worth it. And you're going to make me cry again. But I am really proud of you because seeing you come from, being in vet school and reaching out to me. And that's another thing. People can reach out to both of us. I think I can speak freely for both of us. Please reach out on social media. I have created such a great community. And that's the whole point of it. I am not here to get views or likes. I'm here to spread the word that you can do it. And if you need help or you need to talk to someone, I'm there. Just DM me. It's me. I run my own account.
Yep, exactly.
So I'm here. I'm a resource. I would love to help whoever the best way that I can and offer some guidance. So yeah.
We are here for you, and we believe in you.
We do.
And you're going to get her done.
You will.
It's going to be great. You're going to do great. Just believe in yourself.
Yes.
Please don't lose your confidence. You've got it.
And if you fall, just get back up because that's what matters. That's the character, is how you fight the good fight.
Exactly.
Yeah.
Exactly. Well, thank you so much for being on this. Oh my gosh, I'm so glad I got to see you. Oh my gosh. Well, thank you all for listening. And find us on social media. Thank you.
Please.
Thank you so much for listening to today's podcast episode. We hope you enjoyed it. And if you did, please give us a like, subscribe, and share. And maybe if you did or you didn't, please leave your comments and thoughts below. Do you agree with what was said in this episode? What are your thoughts on this industry topic? Thank you so much for listening, and we'll catch you next time.